Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for spending your time with me. I hope that this content will bring you something to use in your recovery, in your treatment, and planning for your treatment of your hemorrhoids. Today I'm going to talk about some things to look for or what to expect if something is not going well. So you're having a complication or a problem with your banding, or maybe it's not working at all, etc., right? So here we go. Let's go through what you should be looking out for if the hemorrhoid banding is not going a direction you would want. So first of all, of course, in Dr. Chung fashion, we've got to do some talking, right? Hemorrhoid banding, a little overview. It's a small mouth instrument that's used to suck up an internal hemorrhoid. Remember, internal only. If a doctor wants to bend external one, run the heck away from him or her. They do not know what they are doing. You suck up the internal hemorrhoid into that instrument's mouth. You deploy a rubber band at the bottom of that hemorrhoid, and then the blood supply gets choked out so that hemorrhoid dies. The body then heals that wound afterwards. Usually recovery is about 2 to 4 weeks on average, and everything scars and shrinks in and contracts, which is what helps to flatten out your hemorrhoids in that area. Now, before we begin the meat of the video, let me introduce the sponsor of this video, which is Pranicura. You've heard me mention these guys more than once. They've been an excellent part of this program because we both believe in giving you real solutions to help you. This is for itching, fissures, and hemorrhoids. However, I've seen it being used for patients with spasm. Why that cool menthol is helping to distract that pain, that burning and soreness and throbbing people are feeling, and help to distract them from it. It's very soothing, it's very durable, it lasts for a very long time, and I suggest that you try it out. I use this when I have itching problems after a hemorrhoid flare, and that's what helps me the most. Give them a try. You have to go to their website to get it. Thank you so much for paying attention to this sponsor's message, and let's get back to the video. I guess we could go through the very first thing that could go wrong in this procedure. So let's say the doctor just put on the rubber band and say, oh great, we're done with the procedure. And what do you experience? What do you feel? You feel something crazy sharp on the outside of your anus, or it feels really intense and bad, and your anus might be just spasming and freaking out. You say, oh God, doctor, that really hurts a lot. And you know from your basic research and your readings and videos that the pain from the banding should be pretty minimal. In fact, it's more of a soreness, a little bit irritation. I should know I've had 3 or 4 of them at this point, and each one has been exactly the same. I record my video bandings with my wife doing them, and so I tell her exactly where to target things so that I know it's being done correctly. When you feel that sharp pain, the reason is because the banding has been placed on a hemorrhoid that's too close to the outside of your body. That means they banded an external hemorrhoid. It's super tricky, okay? External hemorrhoids go to in the anus just a tad, like a centimeter or 2, depends on your body's anatomy, and some doctors do not understand it, okay? Be very wary. If you feel that pain and it's like really sharp or really bad, don't leave the office. Tell them to get that thing the hell off of you, okay? It's okay to tell them that I feel there's something wrong. This does not seem right. Please get this thing off. I don't think I can bear another hour with this pain. Please defend yourself. Let them know something went wrong. To add to that syndrome of the very sharp pain, okay, it can be an immediate thing, like right after the procedure, like I just talked about, or it can be delayed further on in the recovery. It should never be extremely painful, okay? Something went wrong, whether it's a hemorrhoid flare later on, you know, a massive bleeding incident, something, maybe the band caused a tearing of the blood vessels and there's some bleeding incident. Something is not right. Definitely let your doctor know so that you can get checked out. Okay, what's the next thing that could possibly go wrong in the phase of the recovery? Early on in the first 2 days, you should feel a pretty persistent soreness or pressure in the bottom end, right? Like something's in there, but it's so vague and weird. That's why anal pain or discomfort is so distracting. But anyway, you should feel that pretty continuously for the first 48 hours or so, okay? And then when it comes down, it's pretty gradual, unless it wears off overnight, of course. But if you were feeling it pretty consistently in the morning when you got up, and then all of a sudden at lunchtime, so you had a bowel movement maybe, and you're just like, oh wait, where did that soreness go? I was just feeling it like half an hour ago, and like now all of a sudden it's gone. That might mean that the rubber band just popped off for whatever reason. Maybe it was the bowel movement because it stretched out the inside lining of your anus. Maybe the poop rubbed against that rubber band and it just popped off. Or maybe you did a workout routine and it just decided to pop off at that time. Whatever it is, definitely call your doctor. It's not an emergent situation, but you want to kind of say like, hey, can you put the rubber band back on maybe? Maybe we could try again. So that's what I would ask them at that point. Oh, and about that rubber band, it is really, really tiny. It is smaller than even the rubber bands for braces sometimes, okay? And so will you be able to find that rubber band? No, you won't. Very, very unlikely. My rubber bands I use in my office are black. I don't know if there's other colors that exist out there, but you probably won't ever find it. So the fact that you didn't see it come off, that doesn't mean anything. If you do see that rubber band, then yeah, for sure you've got evidence that it did come off, and it shouldn't have come off within 2 days. Usually it takes about 3 to 4 days for that rubber band to fall off. Another problem you can get is a hemorrhoid flare, which can happen anywhere from the first day you put it on all the way up to day 3 or 4. You may suddenly feel a lot of swelling, and what usually is happening is that rubber band tore blood vessels inside the hemorrhoid, right? Usually that happens when the hemorrhoid is too big and was banded anyway. But what happens then is the hemorrhoid starts to fill in with blood. You can get swelling and you feel like you've got to poop all the time, and the hemorrhoid might even get big enough where it starts to pop out of the anus after you poop. You may even get bleeding with this, but usually the pain is very severe because now there's a huge inflammatory problem going on in your anus. Definitely let your doctor know if this is happening to you. There should be a little bit of swelling, a little bit of annoyance, but a big flare where things are getting big inside your bottom end, things are noticeably more swollen or coming out, that is not normal. The last thing I want to discuss is, how do you know if banding is the right procedure for you? I mean, you hear about people that get 10 bandings or 8 bandings. Like, how many bandings am I going to need, right? So I'll give you an example. Let's say you did 1 banding and you don't feel too much of a difference. Maybe you're not sure if maybe a little bit better, whatever, but not very appreciable, right? You're pretty much the same as when you walked in the last time you got your banding. And so I think it would be fair to try 1 more banding. The doctor may look inside and say, yeah, it's still kind of there, let's try another one. If after the second banding, you don't feel any different still, stop. The banding is not the right procedure for you, okay? Typically, when I do a banding, I look inside the bottom end with my scope, okay? And I'll see various hemorrhoids. Let's say it's a patient with like 3 or 4 hemorrhoids. I'm always banding the largest one first. Why the largest? Because the larger ones usually create the most symptoms, which means if I band the largest guy, the problem dude, I'm going to have the patient see a result. And if the patient sees a result with that, I know, number 1, the hemorrhoids are the issue, and number 2, if I keep going, they're probably going to feel more benefit, and I stop when the patient feels that they feel great, right? But if you're doing like 3 bandings, 4 bandings, and you're like, the doctor says like, oh, I still see it there, we gotta keep going, stop. That means that this hemorrhoid is too large for banding procedures and should be taken care of in a different way, and that's when I would definitely see a surgeon if you're seeing a gastroenterologist, or get a second opinion from another surgeon if you're seeing a general surgeon or a colorectal surgeon. So I hope this list of things that will tell you if things are going wrong was very helpful for you. I sincerely hope that any banding that you go through or anyone goes through, that you feel benefit, and because it's such a safe procedure and the recovery is so good, I want everybody to experience that happiness. But again, it's got to be done right. It's got to be done for the right hemorrhoids, and so finding that right doctor for you is of utmost importance, and especially ones that's going to bail you out of trouble if you do develop a problem, because a perfect doctor does still have problems. Okay, I'm not saying I'm perfect. I've never had a complication. I'm not saying that I know everything here, but I want to make you aware so that if you need help, you can go and get it. So I hope this is helpful for you. You take care. Bye bye.